All right, sounds like we can start. So we will call the meeting to order. The first agenda item is the approval of the Zoom video from November 17th, 2022 of the Board of Health meeting. Can I get a motion to approve the video?
So moved.
Oh, wait, do we have enough people to vote, Tim?
Oh, I think we do now because I think we just got on.
All right, thanks. Can I get a second?
Second.
Thank you. All in favor?
Aye.
Right.
Opposed? Abstentions? Right, sounds like it carries. So our next agenda item is an update on the Community Health Improvement Plan. And I'm not sure who's providing that update, but I'll turn it over to Dr. Motti.
Thank you so much. We're excited to have Rhonda Bartow, who has been our fearless leader here at the department on all things accreditation, QI, the CHIP, and FAB. So she's going to give more of a gross overview of everything that's been going on as it relates to those topics. And then we'll allow for some discussion after that. I just want to commend Rhonda. She's been a one-man army at the Department of Health for quite some time. We finally got her some help in Shantae. Craig has been a great source of help, but most organizations have a full fleet, a team of people doing this. So many thanks to her. Rhonda is one of our longest serving folks at the health department. Are we at 30 years now, Rhonda?
We're at 33.
33 years with the city and the health department. As someone who celebrated a year and that felt like a feat, I just want everyone to also appreciate the level of commitment, service, tenacity, resilience. So to see her now in a leadership position is something I take great pride in. And I just want to thank her on behalf of the Department of Health on this live stream so that it's on record. And I just really looking forward to what she has to share. So thank you, Rhonda.
Thank you. Okay. So can everyone see the screen?
Yes.
Okay. So what I want to talk today about is FAB accreditation and what it is all about, and touch on some key topics that we have to do for accreditation, and to what the purpose of accreditation is. And the purpose behind accreditation is that it's a framework for advancing and transforming the public health practice through performance improvement and innovation, and by building a strong infrastructure and culture of quality. FAB accreditation uses a set of standards that focuses on the foundational areas and capabilities of the foundational public health services model. This model lists the minimum programs and cross-cutting skills that are necessary for every health department to ensure a healthy community with equitable outcomes. Under this model, a health department should support 5 foundational service areas. This includes communicable disease control, chronic disease and injury prevention, environmental health, maternal health, and child and family services, access and linkage with clinical care services. To support these services, the health department must also have 8 cross-cutting foundational capabilities or skills and capacities for the assessment and surveillance, community partnership development, equity, organizational competencies, policy development and support, accountability and performance management, emergency preparedness and response, and communications. Sorry, did that switch slides, son?
No, it hasn't advanced yet.
I'm not sure why that's. Okay, there we go. Okay, all the foundational capabilities are addressed throughout the 10 domains. These domains, our focus areas, are in alignment with the 10 essential public health services model. Within these standards are 93 measures, but some of these measures are extensive. They're also broken down into sub-elements or multiple requirements that all must be met for accreditation. The 3 domains that I want to talk about today are domains 5 with the Community Health Improvement Plan, domain 8 on workforce development, domain 9 performance management and quality improvement, and domain 10, the strategic plan. And this is because these are the domains that have requirements for key strategic plans. These 5 plans include the performance management system or plan, the quality improvement plan, the strategic plan, the workforce development plan, and the community health improvement plan. And the performance management system here is connected to all the plans, and all the plans in the department feed into this what we call our performance management system. We have on the left side of this model, we have performance standards that we use, like national standards like Healthy People 2030, FAB accreditation standards. We have core competencies for the staff and all of these standards. And we also set targets based on these standards for our performance measures that we set. They're all in line with these 5 plans that feed into this system where we have performance measures. We collect these measures, data on these measures, and as we collect the data, we analyze it, we report on it, we look for trends, and then if the data is not meeting targets, then we will implement quality improvement or some type of action to try to bring our data into target. And then we have this ongoing cycle here of change management. And then hopefully we have positive outcomes. If not, we will continue to look at our systems and improve what we're doing. As I mentioned, the performance improvement in building a strong infrastructure and quality culture are the main purpose of accreditation. And in doing that, what we're using is NACCHO's roadmap to a quality culture self-assessment tool. This roadmap leads us through 6 phases, with 6 being the final phase. The Department of Health is currently working on achieving phase 5. This phase lists some of the characteristics seen by the health department once phase 5 is achieved. The slide list it includes things like customer satisfaction being assessed systematically, standardized processes, leaders incorporating quality improvement into the performance appraisal process, and discussions at every leadership meeting in standardized way, and having open dialogue about performance and the use of a fully functioning performance management system. Last year, we worked with all our programs in developing logic models and establishing data collection and performance measures to better align with our strategic plans. We've requested additional positions to expand our quality improvement efforts and to enhance program evaluations more thoroughly, to evaluate processes for efficiency and standardization, to improve data collection systems, to enhance our performance management system, and to evaluate programs through both a health equity lens and an economic analysis lens. We continue to expand our efforts to train staff on QI tools and processes and have had several well-attended lunch and learns for tools such as brainstorming and affinity diagrams, PDSA process diagrams, prioritization techniques. We currently have a consultant with the Public Health Foundation that we have providing train the trainer quality improvement courses to 28 of our employees. As part of this class, we have divided our 28 employees into 5 quality improvement project teams. And each of these projects include outreach and engagement, data sharing and tracking, improving fiscal processes, developing standardized job descriptions, improving internal communications, and developing an employee succession plan. We're trying to become more customer focused and have inventory our customer service evaluations and are going to increase our customer satisfaction surveys. And we're hoping to have at least 2 surveys completed prior to our reaccreditation. We continue to expand and improve our data collection and advance our performance management system to become more data-driven by continually evaluating our performance and researching best practices and striving to be evidence-based. And with our strategic plan, I'm going to let Shante Llewellyn take over and let her explain. She's our health marketing administrator, and she's been with the city for a year. Currently, she was with the city prior to that for many years. So welcome, Shante.
Thank you, Rhonda. Good morning, everyone. Our current strategic plan ends in 2023, and we're working with our consultants, Ascendiant, on developing our next plan. Currently, we have completed what is considered a pre-assessment phase, such as surveying staff and stakeholders and performing various self-assessments, analysis on our strengths and weaknesses, capacity, employee satisfaction, and our quality culture. Our next steps will include to identify 3 to 4 strategic goals with objectives and strategies and an implementation plan, assuring linkages to support the CHIP, writing the strategic plan, updating the performance management system, and linking employee job descriptions to our strategic plan. As far as our workforce development efforts, we are in the process of updating our workforce development plan currently, including meeting some of our enhanced standards that came out this year with FAB. We have performed an equity assessment that considers staff competence in the areas of cultural humility, diversity, or inclusion, a capacity of a health department, both as a whole and within its subunits, and are developing plans to address the gaps identified in these assessments. We have established new policies for a supportive work environment and a diverse and inclusive culture. Staff have been assessed for employee satisfaction, and several efforts have been made and taken as a result from the staff feedback. Job descriptions will need to be updated yet to assure staff are familiar with the core competencies that apply to their job positions and also link them with the new strategic plans. Also new is a succession plan for leadership and key staff positions is in development. These things, along with our training needs assessment and training plan, will all need to be incorporated as a part of our updated workforce development plan. And finally, our community health improvement plan. Community health assessment has been done as a regional plan in partnership with St. Louis County Department of Health. The community health assessment was completed using the MAP Mobilizing Action for Planning and Partnerships process. The data and information obtained from our assessments and community input was then used to identify and prioritize areas of focus for our community health improvement plan. There were 5 priorities chosen: the intersection of economic mobility and health, chronic diseases, maternal and child health, violence, and behavioral health. Several cross-cutting themes were identified, which we plan to incorporate and address in all of the priorities: racism and equity, access to systems and accessibility, interventions across lifespan, participatory, that's a wonderful word, community-driven approaches, and trauma-informed care services. Since the selection of the priorities, we've had 2 brainstorming sessions with action teams, and our next steps are to try to expand our partnership and members on the action teams, get lead organizations from various priorities or for various priorities, and to have a couple more meetings with action teams to develop goals, objectives, and strategies for moving forward. And I want to extend a loud round of applause for Craig Schmidt and Rhonda Bartow for all of their hard work and effort and working in partnership with St. Louis County and the amazing team there and making this happen, and their contributions and leadership through this process. And we look forward to giving you all further updates very soon. And I think that's it. If there's any questions.
So proud. I can't tell you how amazing it was to have Shantae willing to come back to DOH after having been there before. These 3 are truly exceptional. And I think it's important for people to kind of understand what goes into accreditation and the CHIP and all of the FAB requirements. It's a mammoth amount of work. Their dedication to it is only going to better DOH. So happy to take any questions for Rhonda and Shantae at this time.
Okay, can we stop the screen share so I can see everybody? That way I know if folks have if they have a hand raised or anything like that. Thank you. So I do have a question. I noticed in the slide that talked about the different national standards that you look at, there was one point specifically about standards for boards of health. And I remember when I first joined the board, that came up as something we should be looking at as a board. So what I'm thinking about is, as you are developing your plan or finalizing your plan, does it make sense for the board to have an advisory committee or some group that's looking at our national standards to ensure that it's actually supporting and enhancing what you're doing in your planning process? Has that been done before, or how have you normally approached that particular requirement?
From my knowledge about in the past, we presented the standards to the boards, and they were incorporated into, or they were, I don't know if they moved forward on this or at the time, but they were incorporating them into your charter, I believe. So I would take a look at your charter and see what has been incorporated into that. But one of the things as a board, the role for the board is to look at what the health department is doing regarding performance. And we do give the performance reports. Dr. Maddie presents that data to you. And so as a board, you know, we expect you to look at and analyze that data with us and call us out on that. And yeah, I've seen you guys do that all the time, you know, and question, you know, what our data, and that's what we need is to be held accountable to that data and our performance. And if we're not meeting our targets, we expect you to say, why aren't you, and what have you tried? And so yeah, I hope I answered your question.
Yes, that's very helpful. And I see Colleen has a question about whether or not we can get the metrics for the board. So that but I think a part of Rhonda's comment is that some of this has been done. So maybe some of our more senior board members who have been around during those processes can contribute some comments about what happened in the last cycle or kind of where we are. But I definitely think one of the things that I want to do very early next year is to really start looking at the plans and what we should be doing to support the plan. So this could definitely be something that we take up in February at that meeting. So thank you. Other questions or comments?
Thank you for the report, Rhonda and Shante. And, you know, when I looked at it, there's been so much progress made at the department. I really applaud you all. And my quick question is, on the accreditation, I should know this, but when are we up for reaccreditation?
Yeah, so our reaccreditation is the first quarter of 2023 is when they'll open the application for us to apply. And then we anticipate having 90 days, 90 days after that to submit our paperwork for
Okay.
that. Mhm.
Thank you, that's helpful. And I remember you were mentioning the senior members, Serena, you're probably talking about me and others. But I think we went through a pretty cool process last time, I think, going through and, you know, sort of a 360 look at the department. And, you know, and I think that out of that came health equity as a real main focus for the department, among other things. But I think that was the headline that came out of that. So, and I applaud the work that's been done in the department in that regard, but I also would say that there's just been so much work done on staffing that I don't think was even anticipated during that process, because I don't think we thought we'd have somebody like Dr. Marty who could fight for staff. So you know, I think it's probably worth looking through that process. I thought that was a pretty good process we went through again last time. So.
And part of the reaccreditation process is we have a site visit, but this time, the last time they came in person and they spent like, you know, a couple days here, and they wanted to meet with the board and of health and communicate with you. And I believe that will happen again this time. The difference is this time it's going to be a virtual site visit. So
Okay.
it'll be a little different.
Great.
Thank you.
Thanks. Colleen, I see you have your hand up.
Yeah, sorry if I missed this, but how often do you have to apply for reaccreditation? And are there different levels of accreditation? Like, could the department be provisionally accredited, or can you just tell me more about sort of the logistics?
Well, once we're accredited and it lasts for 5 years, but every year we have to submit an annual report and documentation supporting that we're continuing that those standards. And that annual report is a little different each year. So they ask us different standards that we meet and different documents that we have to submit. But after 5 years, then we do a reaccreditation, and that's where we're at right now. And then that reaccreditation, after they do the site visit, and if we pass all the standards, and there's new standards that came out in July of 2022. So we're anxiously preparing and trying to meet these new standards also, and the reaccreditation standards. So once we meet those and we get our site visit, then they'll make a determination, and based on that determination, they'll either say put us or give us a temporary where we would submit like an action plan on areas where they feel we need to make improvements, and give us up to a year to make these improvements, and then make a final decision. Or if there's not any area that they feel, you know, is really in need of an improvement or that of an action plan, then they might go ahead and accredit us, immediately. But that accreditation process, I say immediately, but it has to go through their board, and it takes, probably a few months before we get a decision after the site visit.
Thank you for sharing that. Accreditation certainly is no small feat, that's for sure. Rhonda, was there any areas of vulnerability in our last accreditation that, and maybe this speaks to what Serena was also saying, but any previously identified areas of vulnerability that the board could help support the department getting prepared for this?
Yes, most of those areas that we were addressed, initially after our site visit the last time, we did have an action team, and we did address those areas. And one of the areas, of course, was the performance management system and working to improve that. And that's an ongoing thing. And at the time, we had just got that started, and it really wasn't implemented at the time. So that was an area that, of course, we needed to improve on. I'm not, I think maybe there was some fiscal areas that we needed to improve on too, but I'd have to actually go back and pull out the report and kind of see that, and I can get you that information. And I can get you a copy of the prior report if you'd like that.
That would be great.
All right. Are there any other questions? Lisa?
Now my memory has been jogged. Harold, I think we talked way back when I first started working with you all as a volunteer, that pre-testing our public communication was an area we also needed to work on. Is that true? Rhonda, do you remember anything about that we needed to pre-test or do a little bit more, research with our public?
Yeah, I think what you might be referring to is getting more engagement from a community in the design of our communications.
Right, yeah, that's what I remember.
Yeah, I do believe so. There was some discussion about that too.
And I think that's improved some, especially since Dr. Mahdi is here now, and we've got a lot of more partnerships, but I think that's for any organization, regardless of your form, that's always a huge challenge because it's time consuming and expensive, and it's difficult to step out of the professional creator's role and look at the various lives and perspectives of all of our stakeholders, who are many.
Yeah, Harold could probably tell you more about, I know they did some survey to get some input. Harold, do you want to talk about that? You're on mute. Oh, still can't hear him.
Not yet.
No. Okay.
Harold has made a valiant effort.
But it's also the irony of our top communication specialist being unable to communicate.
Yeah, Kim's there. Kim, can you speak on that?
Yeah, I think what you're referring to is our public health priorities survey that we did we issued that to the community approximately a year ago to get some ideas on what they felt was the priority for public health, and as we were looking at our messaging. And I apologize, I don't have that report right in front of me, but some of the leading elements, the leading priorities that came out of that survey were gun violence and mental health or behavioral health, which obviously through Dr. Mahdi's leadership, we've been working on taking steps to move forward in those paths. with the creation of our Bureau of Behavioral Health that we announced 2 months ago. And that team is actively working on steps to understand where we are as a community in behavioral health, especially around substance misuse or substance use in the area with the overdose data to action. And so, yes, we did do a priority survey about a year ago. We are working on moving those steps forward.
Thank you. I think we have time for one more question.
Yeah, this will be real quick, Serena. And it occurs to me that if it's a 5-year accreditation process, and if that must be that it was around 2018 when we did this, and the world seemed really different in 2018, if you think about it. Between now and then, we've had this little thing called the pandemic hit the health department, and in the whole world of public health has changed enormously, and this department's stepped up. So it's it seems that it's kind of it's probably worth, I mean, I think there's just ongoing looks at what the department's doing in terms of what that and other things, but this is, it's sort of post-pandemic is an interesting time to think about what public health departments need to be doing and what this one in particular needs to be doing. So I just sort of point that out, that we're bookending on that pandemic and we're not completely out of it yet.
Yeah. And with it, I want to point out with accreditation and the new standards I mentioned that came out in July, that's one thing that FAB took into account in the looking at the pandemic and the lessons learned from what happened. And the section on emergency preparedness and response probably tripled in our standard requirements there. So they really focused on that area. Yes.
Thank you. So thank you. We appreciate the presentation. And we're going to move to our next agenda item, which are departmental updates. Dr. Mahdi.
Morning, everyone. I'm going to share screen. The slides that I will be sharing. The slides that I will be sharing will be sent to you as they are usually monthly tomorrow. So you please look out for those. Please take note of those. Please read these. Please read these carefully. Please provide me with feedback. I have yet to have anyone provide me with specific feedback. So I hope that means that things look good to you. But there was a lot of positive pressure that was placed on me to provide more data. And I am placing the same amount of positive pressure to get feedback on how I can improve this report. While I appreciate this board supports me incredibly and supports the work that I and the department do, you know me, I don't have ego. So I want to get things right and improve things to make them accessible and to have information that's helpful. So I'd really like to see this report grow. And so please let me know which areas they are. So this report will be discussing activities for the month of November. And the three main, we're active in many areas, we'll go through those, but top of mind are three sort of high impact areas are the ongoing response to the CVPA tragedy and the alarming rate of increase in winter virus cases, the threat of cannabis infused edible products in the hands of young children, and overdose of adolescents. Also just what movements we've been making in the new Bureau for Behavioral Health. Incredible new strides around new partnerships, gaining an understanding of the resources available to address substance use disorder. So more on that soon. So let's talk a little bit about these high impact areas. These are the areas that I want you to pay special attention to. These are the areas that are of highest concern for us. So the first thing is we are under a triple threat. You've seen this in the news. A lot of people have been incorrectly calling this a triple pandemic. There are very specific definitions for what is a pandemic. So the Department of Health Director does not partake in the incorrect use of that term. However, I would call them triple threats for sure. And let's talk a little bit about why. So there are multiple respiratory viruses in the winter, as you know. That is not new. That has been ongoing for quite some time. However, the unprecedented increase in cases and really record over a decade have become overwhelming. So we saw, and these are for three main ones: influenza, RSV, and COVID. And so we're seeing an incredibly high burden from respiratory illness, specifically driven by these three this winter season. And so I want to talk to you a little bit about each one of these, just so that you understand. So RSV cases reached a record high in the October month. This is a respiratory syncytial virus that causes, like I said, respiratory illness. High risk groups include children and older adults. They tend to, influenza is the second of the three that has been causing a lot of burden in illness and disease. We've actually surpassed the record for influenza cases over the last decade in the city. And we have already surpassed the peak for influenza. That peak usually is in the January to February months. We surpassed that peak in November. The line that you will see on the graph is a vertical line. That is unprecedented. Graphs usually have a nice slope of some kind. The influenza curve right now in the city and in most places in the nation is a straight line. And then we've also seen very mild. Yes?
We're not seeing a graph.
No, sorry, I'm talking about a graph, but I'll show it to you later. And then we have a slight increase in COVID cases as well. So the impact of these three viruses has been very, very severe. And I'll show you a little bit of how that's played out in upcoming slides. The second area for high impact is in our behavioral health. The St. Louis, we have our team, our CDC team is visiting for the week, which has been absolutely lovely. As you know, this is a team that I comprised in partnership with the CDC while we wait to hire for the Bureau itself, which, as you know, has challenges. When I came, I remind folks that from posting to hiring, it was sometimes a 6-month turnaround. We've been able to get that down to 2 to 3 months, but in transparency, because of short staffing in DOP and challenges that they've had as they've transitioned leadership, even though we sent requests for those positions to be filled in August, they were only filled 2 weeks ago. And so we still have to wait for folks to apply, interview, and that can be challenging given limitations in salary. So it really was pivotal then to have the CDC team. That was my goal in having them here for this year, was to provide that buffer and so that the work would not be delayed. So they have been phenomenal. They finished, they presented to you at a previous board meeting, the 4 phases for their strategic plan and implementation. They are through phase 1. Had a record-breaking assessment survey that went out with close to 60 community groups responding. They have built 2 maps that will be public-facing and that are a part of a broader a dashboard that they are building out for us. They have hosted 2 webinars to introduce themselves and the work of the Bureau that were attended by more than 100 behavioral health specialists in the city. They have started a task force. The kickoff meeting was on December 8th, and they are currently meeting with over 20 groups this week. And you'll see a report come out next week on all of the activities that they've been a part of this week. Another thing that we've been involved in is the tragedy that occurred around the CVPA school shooting. I convened a group of 33 behavioral health specialists. We've met every 2 weeks, taking some time off for the holidays. And we added community resources to our website from the different partners that have been involved in CVPA response, including the Mental Health Board, Department of Mental Health, BHN and the Regional Health Commission, as well as a slew of our federally qualified health centers and a slew of other community grassroots who really rose to support CVPA. We focused on acute response efforts and chronic response effort, but that our city website had and continues to have behavioral health resources for both the school and the community. We also proactively created a Google map of CVPA, all nearby schools and locations where crisis support was provided. You'll hear more about this on the report that's coming out next week. The data is a snapshot that indicates the continued high need for behavioral health support. And our hope is that this map will continue to help our partners plan and be able to do more targeted interventions for the school and the community. Last but not least, as many of you know, the new legislation around marijuana was implemented, and why this was important from an equity standpoint for Black and Brown adults that have been disproportionately criminalized unfairly. However, there are concerns for threats now in our city and nationally around adolescents and young children, and an alarming increase in overdose. So we have started an education campaign, health alerts going out to a list of over 500 people. Social media campaign will be dropping tomorrow, and we will continue to educate the public about the importance of protecting children and why this is of high concern. So COVID-19 daily case counts and hospitalizations have decreased slightly in November until the Thanksgiving holiday. There were 5 reported COVID-19 deaths in November, and the new variants of concerns that have emerged are the BQ1 and BF7. The bivalent booster is available. It's an updated booster. I was very happy to hear Dr. Tim say that he got his booster and his flu shot. So be like Dr. McBride and get your booster and your flu shot. You can get them both on the same day. And our website provides information on locations that you can get those in the city. We are still in the level of high transmission in the city, although the community level continues to be medium. We did have an emergency pandemic task force meeting, and emergency rooms are overwhelmed. So it's really important to be thoughtful about prevention measures. The CDC has now reinstated masking. An advisory went out where they have said that masking indoors is their formal recommendation. And so coming into the Christmas holidays, both the booster, masking, and other mitigation strategies must be prioritized. So you heard me talk a little bit about influenza. So I just wanted to provide you with a little bit more granular information around that. We have 1,978 confirmed cases of influenza as of December 3rd. 97% of those have been influenza A in the 2022 to 2023 season. We've already surpassed the 10-year highest peak number of cases seen in the 2017 to 18 season. Individuals aged 25 to 49% make up the majority of cases this season at 29%. And like I said, as of December, the CDC recommends masking indoors. And so you can see the influenza case counts here by different season, and that peak has already been was already on the up and up. I have a second graph that I need to bring back to this group that shows this a little bit more clearly as well. Violence prevention efforts. Sorry, I'm having issues with my computer. Give me 1 second, please. Trying to resolve this. I'm just going to stop screen sharing for 1 second. There we go. Okay, let's try this again. I may have to keep it in this view for a little bit because it keeps blanking my screen, so I can't see the slides. So forgive me for not being in slideshow, but this will be helpful on my end, and my apologies. So in terms of violence prevention, as you know, violence prevention efforts are being prioritized in the Office of Violence Prevention under the leadership of Director Will Pinckney, who I work closely with. They've continued in 3 cure violence catchment areas. The graph that you see on the left shows the number of gun-related assaults, robberies, and homicides in those 3 catchment areas. Aggravated assaults have seen a sharp decrease in 2022 compared to 2021, so that's great news, whereas homicides are roughly the same. November also saw a slight decrease in aggravated assaults across St. Louis City, which is not pictured, and within the cure violence areas compared to October. The Cure Violence team didn't hold as many community events, but were able to intervene in 17 potentially violent interactions, which is a 42% increase compared to the month prior. That's really phenomenal when you think about the type of manpower and resources that they have. Violent activity tends to peak in summer months, so we might expect cure violence interruptions to decrease in the fall and winter months. A little bit more granular data about what the OD2A team has been doing. So in addition to them hosting that kickoff meeting that I told you had over 100 people total, they've created the map of treatment, detox, and prevention services in the city based on their first assessment, an environmental scan of the city. So that data collected from over 50 respondents helped to identify all available prevention, treatment, and recovery and harm reduction services. We have, from a substance abuse and overdose perspective, from October to November, 25% increase in ER visits for drug overdoses, also a 25% increase in EMS calls during the same time frame. From a mental health perspective, EMS calls in November were most often for residents from 3 main zip codes, 63111, 63116, and 63118. And that dominates most of South City. Let's talk about the efforts of our small but mighty communications team. During the month of November, the Health Promotion, Education, and Marketing team coordinated the DOH leadership and staff on various events. The staff worked with STL TV and the Bureau of Behavioral Health to host the roundtable discussion with mental health leaders in the St. Louis community. 2 presentations that I did. I was the keynote for the Masters and Johnson and Lecture Series. They have done a phenomenal job of creating and now building that. These are out and you should be seeing them when you drive around. Street level billboards and bi-state metro transit around these respiratory viruses and flu. Radio ads were scripted to highlight respiratory illness, World AIDS Day, and the Take Me Home HIV testing kits. We did some videos around HIV and AIDS, recognizing lives lost from the disease, advancements in testing and treatment, and observing World Health AIDS Day. We did a health alert from the Water Division regarding a boil water advisory for portions of downtown North City and South City. And then social media continues to be active. As you've seen, we've seen an incredible amount of growth and participation from the public using social media as a medium. So from a fiscal and payroll perspective, we have hired 53 people since I started last October. In the last month, we hired 8 people, but we've lost 5. I continue to impress upon you and the administration that the challenges and exit interviews that we are seeing are around high salary 1 through 5, and then burnout from public health, especially from the pandemic, being second. So retention is really the focus, but it's really made difficult with limitations from a city perspective. Kim, go ahead and share screen, please. The fiscal team also continues to work with a consulting group that I told you we hired to really help to strengthen our fiscal services. And that group is Armamino, the Armamino Fiscal Group. They are starting implementation phases around invoice tracking procedures, and better ways to track our contracts as well, so that we can improve the significant delays that have consistently happened over the years. They are also working with our new commissioner, Commissioner Ann Worry, who has really hit the ground running and is a phenomenal leader and partner around, she's completely restructured the way that we do our budget, application cycle. And the executive leadership team have already shown a lot of gratitude for how early we've started this year and the level of detail and additional information provided to help them to be really thoughtful about budget. I'm being very aggressive, and I want to be on record about this, about my budget request for next year. As you know, DOH continues to comprise just above 1% of the city's budget. The department itself got less than 0.05% of the ARPA allocations that were recently awarded. And so we are hoping to really see increases in our overall budget over the next years sequentially through the city. And I'm hoping to hire a full-time grants writer and manager for us to hopefully increase some of our support through grants as well. We'll shift to communicable disease. And the CD team has been very busy. They 2-week completion rate is 100%. And so they've been working really hard to make sure that cases are completed in a timely fashion. The team updated its communicable disease case investigation policy to really help to strengthen that. And as you can tell, the metrics that they've set for themselves have either been stable or increased across the board as it pertains to HIV. Next slide, please. When we talk about TB, the state of Missouri conducted an audit to assure that contractual services are being performed per standard. Our TB section passed the audit with only 2 minor deficiencies that have since been corrected, so very proud of them for that. And we were also re-awarded medical screening, a grant for just over $15,000 for our refugee health through the U.S. Committee for Refugee and Immigrants. Monitoring in the hepatitis program continues as well. And again, no significant reports there. When we move to chronic disease, we finally were able to hire a public health nurse. As you know, this has been something we've been trying to do for over a year and have had challenges because of non-competitive salary. So we welcome Ms. Margaret Laycock, who's a public health nurse too, and has joined the department in the Show Me Healthy Women program. Yolanda Mitchell with Denaro Max Help have solicited over 16 YMCA lifestyle change program referrals this quarter to combat diabetes and hypertension. So we're being very intentional coming out of the pandemic in increasing our program visibility and support for chronic diseases in our community. When we look at what our team is doing around maternal child health, we've had 6 referrals to the building division for inspection around lead remediation. We have also, one of our really hard workers, Lakiska Stevenson, completed 6 asthma prevention lead safety educational studies in the city of St. Louis. They've been doing a lot as well around primary prevention. And so just great work coming out of there. Additionally, the maternal health clinic performed follow-up on 5 child fatality cases, tragedies, but we need to collect that data and make sure that we're accountable and can prevent future incidences. Both Nurse Gren and Yvonne Franklin also completed FAB submissions for the Bureau. In regards to environmental health, in November, food and beverage control officers conducted 650 time-sensitive notifications in response to a downtown boil water order. Excellent work there. They've also been increasing their visibility and in addressing high-risk establishment inspections. When we look at our community sanitation teams, we've been limited here by staffing shortages that we're trying to address. But when we moved to animal care and control, we hired another 2 animal care and control officers in November. We were able to maintain to get $2 million in ARPA funds through 2026 that we will use to strengthen requests for proposals and RFPs to subcontract for additional services to try to help stabilize the critical issue around animal care and control in the city. Additionally, I met with Department of Personnel Leadership, and they were willing to work with me to provide incentive starting bonuses, as well as salary increases across the entire section for animal care and control. Having succeeded with that, I've been able to get entire salary raises for 2 additional sections in the health department. So we'll continue to chip away at it, but we're doing a much better job around equity and making sure that we can attract really good quality for animal care and control. We had a great report on FAB and CHIP, so I will skip that. So our last slide is just to show you that in this month's report, you'll see a new section that I've asked to be added. As you know, I promoted Michelle Turner to the position of really focusing on personnel and hiring and retention efforts. She has done some phenomenal work. She has partnered with Slate. We were there for 5 weeks continually for in-person visibility and attracting talent at the Slate Holly Jolly Job Fair. So for the past 5 weeks, we've had a table every day, and we were able to get 17 applications, and we've already hired 1 person as a result of that job fair. She has also partnered with Slate to provide monthly job listings to their extensive listserv. We have built our own listserv as well to send monthly job availabilities to the city. So you will have these every month. And one thing that you can do as leaders and should be doing, and I'll be holding you accountable, is to send these job openings to your networks to attract good talent, to also open them and send me recommendations, especially for ones in our behavioral health and senior manager positions. I can really get help. They haven't posted the grants manager position yet, but when that becomes available, we really need help there. So every month you will have these in your inbox. All you have to do is copy and paste and send them to your networks. So this is an active thing that all of you can do. And I'm challenging you all to see which Board of Health member is going to be responsible for the most referrals for jobs for the health department, given how easy we are making this for you to do. And then, as always, you can see what activities we're up to as a department. So I will stop there and take any questions.
Thanks, Dr. Marty. Any questions? Tim, your hand's up.
Fabulous report as usual, and thank you, Dr. Marty, to your team as well for pulling that together. And it's really well organized, and I do read it when it comes out again, actually, you know, and share it as well with my public health colleagues at the school, because I think they need to know something about what's going on in the city and public health and the great work you all doing. On the influenza numbers, you know, it's obviously something that comes up every year, but it does look fairly alarming what the numbers look like, if I heard you describe that correctly. And, you know, and I know, and you described all the communication we're doing around that. You know, there's probably public health fatigue out there, and people are just like, oh yeah, whatever. You know, nobody wants to get vaccinated, and I don't know exactly what my question is, but it's like, what can we do to try to stem this tide, I guess, because people are going to.
Yeah, I'm going to send a couple of attachments. So I've been sending you monkeypox. When monkeypox was at high, you would get the monthly report, you would get the sort of detailed write-up, but then I would send you these monthly reports that my EPI team does on specific things. So you'll have one for influenza that will give you more granular data. We also did, as part of a public an education campaign, I'm going to share screen just briefly here. We've tried to make this as easily accessible as well. So we have a few slides. There's just 6 slides that also sort of impress upon you what's happening here. So this is the graph I was hoping that I was going to share, that shows the influenza A virus detected by PCR. And it shows you this is our season currently, this almost vertical line. We haven't even peaked yet in comparison to prior seasons here as well. And so it shows that steep increase in flu A positive cases with more than double the amount of weekly cases compared to that prior season. And there've been and that data I gave you. It also does a little bit more high impact visibility for education around RSV, letting you know which groups are at highest risk. We did the same for COVID, right? Explaining the high transmission rate, and also encouraging people to stay up to date with their vaccine and boosters. It impresses upon you the fact that the CDC is now recommending wearing masks indoors, especially around immunocompromised and the elderly. And then it ends with, what are the main takeaway tips of what you should be telling people? Stay home if you're sick, get your flu shot, stay up to date with your COVID-19 vaccines and boosters, wear high quality masks. This should be N95 masks, especially around high risk people. Washing hands, avoiding crowded indoor spaces, socially distancing when possible. Gives our website so folks can contact us. So I'll attach this as well if it's helpful. And then the last thing I was hoping to show you, let me see if I can find where I have this. So we put together, the task force worked with us, we did a phenomenal job and put together an infographic that really alerts people around when to stay home when they're sick versus when to go to their primary care provider or FQHCs if they don't have one, or urgent care, and then the specific criteria about when to go to an emergency room. Our emergency rooms are overwhelmed, so that's another really important message. So we'll share with you that infographic. And for emergency rooms, it's when you can't breathe, when you have very specific symptoms. So I think that's an important educational campaign too, because we acknowledge that people get sick, but we're helping people to really think about, do I fall into the mild or moderate or severe category as it pertains to my current symptoms? And if I do, where do I go for help, right? And we really need to save emergency rooms for people who are in crisis, right? So I will provide you with all that information with those reports. As always, Kim is quick to the chase and is putting some links here for you as well. But I hope that helps to answer your question, Dr. McBride. So you'll have the more granular monthly EPI report. The link is also in the chat right now if you'd like to see it. And Kim is always on it, so you have these graphics as well linked to our social media pages.
No, you answered the question well, and those additional graphics really help. And what to do about this is really important. I recently had what I think was a cold, but I was trying to sort it out between cold, flu, COVID, all that. But I think it was just a bad cold. So
it's the hardest thing. I mean, coming into the Christmas holidays, we expect people to get sick. Everybody wants to be with family. Get at-home test kits and make sure you're negative before going into family parties, especially with elderly people. Mask indoors, take them off to just eat. You know what I mean? Try to create space, social distance, have hand sanitizer. I have a big jar. It's the first thing you see when you come into my house if you're visiting. So everybody can just use it and you don't make people feel bad. Encourage people to wash hands. These are things that we must do. We always see spikes in cases during the Christmas season, and our hospitals are overwhelmed. ICUs, including ICUs for children, are overwhelmed and they're turning people away. They can't even accept new cases. And so we're putting children and high-risk people in danger if we continue to overwhelm our hospitals.
That's great. Well, it's not great, but thank you for saying that. If I could say one more thing, Serena, or a different topic. And we have Colleen on.
After you, I believe.
I'm sorry?
I said yes, and then Lisa has a comment after you.
Oh, you want to go first, Lisa? Is it on the same subject?
I just wanted to ask Dr. Motti, is the type flu A what the flu shot this year is supposed to address or prevent, as far as you know, or is that too complicated or too weird a question?
Not a weird question at all. It's just, unfortunately, the reason why the flu vaccine every season has 50 to 65, depending on the season, at percent efficacy, is because they have to make it and try to anticipate what variants are going to be. So they cannot target something. It's not like the COVID vaccine where we wait to see what the variant is and then we update boosters. They have to make all of these in bulk to get out to the public. And so they have to do the best thing they can to cover all strains. Matt Haslam, our senior epidemiologist, who is phenomenal and really has led and now has a great team below him to support all of his efforts. And as you know, has been the person that's helped with COVID, also tells me that the flu shot this year is supposed to provide what we believe is decent protection for this strain. So we think it's a good one, but the way that this works is they have to anticipate strains in advance. So I hope that helps.
Yeah, it does. Thank you.
Yep.
If I could follow up on my other question, and I think if Colleen's still on, I might pull her in as well. You know,
I'm here.
Great, Colleen, thanks. After the Dobbs decision, you had the parts in there about maternal health. And I've been, of course, worried like a lot of people about continuing, you know, effects of the Dobbs decision just on maternal health. And, you know, you're tracking that in the report, and I'm just wondering if we are seeing any. I know that Colleen and her colleagues are doing great work in Planned Parenthood to help respond to that, but one of the things that's worrying me about is the just reaction to pregnant women, and are they getting the appropriate care because of their concerns that they have around the Dobbs decision. So, and if we have any numbers on that, we probably don't, but just comments about that.
I'm happy to share a little bit about what I know. So I think probably locally, folks are still getting good care, good miscarriage care. They are getting, if they need abortion care, they're getting generally across the river. There is certainly a gap still of folks who are too medically complicated to have outpatient care. We no longer have a hospital-based option for them. And so that is tricky, and we're working on making that better. For now, generally, we're sending people to Chicago if we can't complete their care as an outpatient. But I think the other area, I think that is not true across the state. And so there certainly is still a lot of confusion from hospitals and from physicians, other clinicians about what is and isn't appropriate. And or I guess actually the concern is not what's appropriate. Everybody knows what the best medical care is for a person presenting with some sort of need. The issue is around confusion and fear about what is legal or not. Because of course, as you all know, the consequences now are criminal. They're not just, you know, a sanction against your license or a civil penalty. You know, a violation of the Missouri abortion law comes with some jail time. So we are actually somewhat hopeful about the new Attorney General, although he is certainly not pro-abortion, or he won't do anything to help remedy what the current situation is. I do think, or many folks believe, that he will not have the same rabid political approach to abortion that our outgoing Attorney General has. So that will hopefully be helpful, particularly for hospitals who are just trying to figure out, you know, how do they take care of people in emergencies. I think that the answer to the question around data as it pertains to maternal mortality and morbidity, I think that we will sort of see that in a more long-term sort of way, right? Like over the next couple of years, we'll start to see some of the impact of the Dobbs decision and maternal mortality across the country.
That was very helpful. Thank you.
All right, are there any other questions for Dr. Mradi about the departmental updates? If not,
Sorry for the tech issues, but as long as it's impressed upon you that you should be talking about flu and influenza and the triple threat issues, that there's this focus on marijuana and that we need to really be talking about this issue for young children and adults, and that the Behavioral Health Bureau is moving well, but we really need help because of the delay in getting job postings in referrals for good people. So please, 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 can you send referrals to me? Can you send those across your networks? Thanks, everyone.
thank you. All right, so our final agenda item is a preview of our 2023 meeting schedule. So you'll remember that we wanted to do an in-person meeting to recognize Dr. Ross and also to thank our outgoing board members, and we weren't able to get the date to line up for December. So now we're looking ahead to January. You will likely get a poll asking you about your availability, but we're looking at January the 12th, which is not our traditional date. It's not the 19th. So we're looking at whether or not the majority of us will be available to meet in person on January the 12th. you'll get some follow-up communication so that we can get a count for who can do that. And then during that January 12th meeting, again, we'll acknowledge and thank folks who are transitioning off of the board. And because we're in person, it will also be a good time to look at our committee structure and make some decisions around the committees that we want to take forward and any committees that we want to discontinue. So the goal will be to actually make a decision at that meeting regarding committees. So we'll also possibly be able to talk about some of the standards that were just shared around the board's role in the accreditation process. So we'll see how much business we can get into that January meeting, depending on what date we settle on. For the February meeting, what we'll do is use the first portion of the meeting, likely about 30 minutes, for the departmental updates and specific initiative updates. And then for that last hour, we'll use that time for orientation for new board members. If you're an existing board member and you didn't participate in the last orientation, or you would like a refresher, you're certainly welcome to participate. But the hope is that we can use that time that we've already blocked off in February to have orientation for the new members, so that when March rolls around, everybody's kind of ready to hit the ground running when their terms begin. So that will be an adjustment for February. And then March, we'll go back to our regular using the full time for the board meeting. Any questions? All right, so be on the lookout for an email so that we can finalize our January date. And with that, the meeting is adjourned. Thank you, everyone.
Thank you, everybody. Have a good holiday.